One of the current concepts within pain neuroscience is that you don't necessarily have to have tissue damage in order to experience pain. Pain is our brain's construct of a perceived threat. So if your brain perceives a threat, it's going to create pain so that it causes you to do something about the threat that it's experiencing. One of the studies that they did looking at this is they had two groups of individuals and they applied a stimulus to these individuals. With the one group of individuals, they explained it as a very pleasant response, very simple thing that was going to be done to them. Whereas the other group, they explained that this stimulus that we're going to do is going to be very painful, it's going to hurt. And the two different groups experienced very different outcomes when they had that stimulus addressed to them, showing that based on what the brain's perceived expectation was or the perceived threat, they experienced that process differently. And we can use that in order to help your brain to unlearn some of these pathways. It doesn't mean that people are crazy or the pain is all in their head, but some of these different pathways become hyper facilitated within the brain. Even though there was an injury at one time, now that pathway and that process doesn't really suit the person anymore, even though it's facilitated in that way.